Hello, my name is Kelsey Poon, and this is my presentation on mental health in the workplace. Who is affected by mental health? 47% of working Canadians consider their work to be the most stressful part of daily life. Mental health is actually the number one cause of disability in Canada, where 1 in 5 Canadians experience mental illness. That's actually 7 million Canadians. 60% of them are parents. That being said, everyone, everyone is affected by mental health. It concerns and affects everyone in the workplace and at home, and it does lead to serious consequences for workers as well as for the organization and for everyone around them as well. It is crucial to identify the sources of the problem and to understand the causes before the implementation of any action plan. Understanding the risk factors and being able to prevent and support, along with having a really good supportive organization, can help companies and workers come out on top. So why is it so important? 82% of employees with mental health issues indicate that it impacts their work, when only 53% of those with physical health issues say it impacts their work. 43% of employees would like to receive more support from management and human resources, while 63% of managers would like better training to handle situations revolving mental health concerns. So mental health in the workplace continues to become an alarming issue as it often is overlooked by not just management but also by other employees in the workplace. And it's usually not taken that seriously anymore. Managers are starting to notice the impacts of ignoring the issues in their workplace because it does negatively affect the whole organization in terms of performance and the productivity of workers, having increased absenteeism, presenteeism in the workplace, high turnover rate because employees are leaving the company, um, poor interpersonal relations, and even higher costs for the organization. So what should be done? First, we must look at and understand stressors. Canadian workers actually report that work overload and poor interpersonal relations are one of the top sources of stress in the workplace. Work overload is actually the excessive amount of work that workers are required to be completed, uh, either within a certain period of time or just overall. Poor interpersonal relations is if there's a lack of social relations in the workplace or a lack of support. It does intensify stressors and also can become a factor for stress. In order to kind of tackle that in the workplace, we should always promote and teach ways toward leading a balanced lifestyle, whether it be work-life balance or work and family at home balance. That's really, really crucial. Workshops and tips on time management and prioritizing really help alleviate workload, and it also promotes social functioning as well for employees. In order to promote more interpersonal relationships, events, contests, communications, even just celebrations or normal outings, or having a break together really help promote social relations in terms of growth in the organization as well. Um, mental health, mental stress does not only impact that one individual going through it, but it does put a lot of stress on the people around them as well. And especially if it's not, if it's left untreated or left ignored, I guess, if it's left ignored, it could lead to more damaging and long-lasting effects for everyone in context. WSIB states that they allow claims for work-related chronic mental stress under Bill 127. However, it is very difficult for people to actually meet the criteria that are mandatory in order to be approved for compensation. The reason why is because just last year, 94% of these claims were denied just because of they did not meet the criteria. If this is the case, they should review their policies and determine whether or not they should change their criterias or determine just a better way in order to help people get the compensation and the help that they actually truly need. The three criteria are: number one, workers must provide a diagnosis from a healthcare professional. That's actually very difficult because chronic mental stress and traumatic mental stress are both very challenging to prove to a doctor. Proof of work-related stressors also must be provided. Number three, the workplace incident must be predominant cause of the chronic mental stress. The Provincial Workplace Compensation Board may need to review everything altogether, take a step back and to reassess because 94% is a very, very high number. That means 94% of the people who actually sought help and they sought compensation were denied and they're not getting the help that they need. That means that their case and their mental stress or their chronic mental stress is getting worse. Occupational health psychology is actually, they actually emphasize on identifying and understanding occupational factors that increase the likelihood of workplace injuries, whether it be physical or mentally. They actually aim to improve the quality of work life and to protect and promote the health, safety, and well-being of workers. They actually came up with a four component strategy, and should be mandatory in every organization's health and safety board. And the information should be readily and available to everyone in an organization because it really helps provide and set um, guidelines, and it targets everything in an organization. Number one, the organizations should offer and implement organizational change. Number two, they should provide relevant information through either workshops, trainings, guest speakers, and so forth. Number three, they should always promote positive and healthy work ethics. And number four, they should monitor and adapt to changes and risks on an ongoing and consistent basis. By showing workers that the company has a focus on psychological health and by providing them with the services, it really could compensate for any stress in and out of the workplace as well. So managers actually do have a duty. Their duty is to create awareness. They must provide information. Effective time management is crucial. They must ensure to build stronger interpersonal relationships within the organization. They should have preventative and support plans and monitor and adapt to changes as noted as well. So these also fall kind of a lot of it falls within the occupational health and psychology, therefore, four-component strategy as well. Another thing is mental health first aid, MHFA. So being a mental health first aider should be mandatory, at least for management, or at least for the people or of the board of the health and safety committee of board in every company. There's no harm in starting a prevention plan and ensuring that it is a standard, because that only benefits the workers and everyone that's licensed with as a mental health first aider. Um, they they focus on recognizing, they recognize the situation. They want to, in order to respond with conversations and in a proper way, and then to guide those in need to resources and to sources that actually can help them. The benefits of mental health first aid is productivity in the workplace, cost savings in terms of disability and absenteeism, operational success as a whole, recruitment and retention in terms of kind of minimizing that turnover rate, conflict reduction as well, and operational success. Um, that being said, if one is trained with in mental health first aid and they actually gain the knowledge to better identify situations where someone should intervene, and they also gain the competence in doing so, um, because they're equipped with the right ways to respond. Implementing this change will allow managers to also understand the workers and to empathize in situations that are required. Acting efficiently will also significantly improve the well-being and mood in the workplace, decreasing social distance with the people with mental health issues, and it also empowers managers to provide the best care that is needed.
As an employer, it's important to understand that your employees aren't going to be super funky, happy people 24 hours a day, 7 days a week, 365 days out of the year. That doesn't mean you're doing anything wrong, but at the same time, if an employee is having a bad day, it'll certainly affect their work. So how can you help? How about introducing an EAP, an employee assistance program? It isn't just a gimmick to entice employees to sign on the dotted line. It's a way that companies can not only invest in the physical well-being of their staff, but also contribute to their positive mental health. Stress, anxiety, and depression affect 1 in 5 Canadians, and mental health is the main cause for disability claims and prescription drugs. By introducing an EAP for as little as $5 or less per employee per month, you can instantly improve the lives of any staff member who may be struggling under the weight of issues such as bullying, anxiety, family stress, financial strain, bereavement, depression, health, trauma, and work stress. EAPs help create a simple yet effective formula. Employee plus EAP equals a happy and productive work environment. As an employer, you have the opportunity to make a positive impact on the life of your staff. Contact Insurance Portfolio Financial Services today.
So as we can see from that video, having an employee assistance program does help employees when their mental well-being is being considered as well. That being said, it is very important to kind of have some funds and allocate that in order to provide this for employees because in the long term, it really helps when we're responding to mental health related issue, supporting their productivity and their willingness to provide good performance. This really helps with retaining good employees and also minimize turnover rates as well by supporting them in ways that make them feel good and taken care of. This is actually a lot more effective than just ignoring their needs and using the funds elsewhere. How can employees help? There are actually 8 top practices that the Employment and Social Development Canada came up with. Number 1 is to encourage employee participation decision making through support. Number 2 is to clearly define employees' duties and responsibilities. Number 3 would be to promote a work-life balance, which was actually stated earlier in my presentation. Number 4 is to encourage and model respectful behaviors in the company. And number 5 is to manage workloads. That would help minimize any stressors as well. Number 6 is to provide training and learning opportunities. Number 7 is to have conflict resolution practices in place. And you also have to make sure you tell that to your employees and how you go about in that. And number 8 is to recognize employees' contributions effectively. That being said, a lot of this was repeated from my presentation, which comes to say that it is very crucial. Mental health issues in the workplace is very important. We must always assess the workplace for hazards, whether it be physical or psychological. We should always develop a plan and to address and mitigate that, and also understand the Health and Safety Committee, their policies as well. Providing a safe and inclusive workplace where workers feel happy produces significant and long-lasting results. Here are some of the references that was used, and thank you for listening to for my presentation. If you do have any questions, feel free to contact me at my email as well. Thank you.